Hi, good morning. Don here. Welcome to Podiatry Practice Mastery. We're helping you get your practice to the $1 million mark and beyond. So today I'm going to talk about a day in the office. This is a Monday. So I'm going to go over kind of what was working, what wasn't working. So I guess the best thing that worked is I think I did 3 pairs of orthotics. So my goal most days is to do 2. So this day was a 3 orthotic day, which is mainly my main focus. Just try to get 2 pairs every day. That makes it for a good month. First patient was a matrix, right medial hallux, 19-year-old. Second patient was a plantar fasciitis pain, new patient. I went through everything, x-rays, ultrasound. She's going to do the Pelto special, but she did not want to do the shockwave, and so she's going to go to PT, see her back in 2 months. If not better, then we're going to be doing the shockwave for her. I'm using my new plantar fasciitis treatment sheets. If you guys want one of those, shoot me an email, don@podiatrypracticemastery.com. This kind of explains everything that I do in kind of the order I do. Next patient was a patient that came in for sesamoiditis/FHL pain. And I did x-rays, ultrasound. He's going to be doing like foam rolling on the bottom and loosening up the area on the back of the calf. I'm going to see him back in 3 weeks. He also got an anti-inflammatory. Next patient was a patient with a midfoot arthritis, kind of some spurring midfoot, having a little nerve issue. So I was talking to him about like cross-frictional massage and really shoe gear to prevent that. Trying to avoid doing an exostectomy for him. Next was a patient. She's number 5 out of 6 for second metatarsal head shockwave bilaterally. So this is like our MVP patient. So this patient's probably, she prepaid I think about $3,000 for this, and she's finally getting better. She's one that recommended a book to me I recently bought by a chiropractor, kind of a sports med chiropractor, Dr. Michaud. Next patient was a Qutenza question mark patient. I'm going to check on Qutenza, did a diabetic foot exam, nails. Not sure how he got into this visit, but he also had a longitudinal melanonychia, and I did a nail sample. I'm going to see him back in a few weeks, and I think I'm going to do a punch biopsy for this because it's like a black one. It's causing the nail to crack, so I'm going to do a biopsy on this to see what's going on with his toenail. So usually the way I do those is I take back the eponychium proximally, and I do a 3 millimeter punch biopsy at the distal nail matrix region, like the lunula area there, where it has the dark discoloration. And I don't do a ton of those, but that is one that I'm going to be doing. Next patient was a 18-year-old girl. Unfortunately, she had one of these like layered nails that kind of like wavy, and so she had some type of nail trauma. So I brought it all the way back, did a nail sample. I really talked to her. I think she should do Cariflex in the summer, and then once summer is done, avulse the nail, and then as the nail grows back, put an Onifix on it after 3 months. So it's kind of a staged procedure to help it to reattach. Hopefully that'll reattach, and then clear out any fungus as there is fungus. I'm not sure if they're going to do that, but that was my recommendation. Next patient was an IND for a hallux bilaterally. Next patient was a 19-year-old for flat feet. She's had orthotics in the past, and she got another pair of orthotics today. Next patient was a 68-year-old guy. He had a neuroma. Did x-rays, ultrasound, and a cortisone, and we also scanned him for orthotics. So that was orthotic number 2. Next patient was a 51-year-old. She had an itch on the lateral fifth med base. This is funny. So she had an itch, and I gave her clobetasol, basically something to help reduce the itch. Next patient was a 70-year-old that had was previously seen for a sesamoiditis by one of my colleagues here, but it looked like a cellulitis today, and I did antibiotics for that patient. And so I'm going to see them back in about 2 weeks. Next was a bunion patient bilaterally. Spent most of my time talking about shoes for this patient, giving shoe recommendations. Next patient was a 60-year-old man. Don't remember what I did for him. This is getting towards the end of the day where I don't write everything down here. Next patient was a 71-year-old that a really bad arthritis to the talonavicular joint. I did a cortisone injection, x-rays, and see them back in 2 months. And possibly in the future to... Actually, I scanned her also for an orthotic, sorry. So maybe 4 orthotics for the day. That was a good day. And last was an ankle arthritis patient. Did a cortisone injection to the ankle. He's come back, so like every 4 months. And then there was a shockwave follow-up that is going to go to PT. And then another patient that came in for left plantar fasciitis, they wanted an ultrasound-guided cortisone injection. So they came in specifically for that. And so I did that cortisone injection for them. And then last was a matrix follow-up, or actually a matrix patient, a 36-year-old. So that's kind of the day. So it was a good orthotic day. The way I tend to explain orthotics these days is I do whatever the treatment is, the shockwave or the cortisone, and I say, well, to help the mechanics of your foot so it doesn't keep coming back, that's when I do the orthotics for these patients. And some accept it, some don't accept it, but I do find that it helps them, and I stick behind the orthotics if there's modifications and things that are needed. But I really think that's the low-hanging fruit. I wasn't as good at that in the past. I didn't have the confidence to do the orthotics, but I find the orthotics really make things a lot better. Okay. Once again, you guys have a great day, and then until tomorrow, we'll talk more. A couple of things I'm working on. I'm reading this great book called Buy Your Time Back, if you haven't heard about it. That's kind of the latest thing that I'm reading about, and I'm already buying that back with my scribe, but I'm thinking about getting more of like a personal virtual assistant to help offload even more things. Okay. Love to know if you guys are doing that, if you're finding it beneficial, if anyone else uses like an executive assistant or personal assistant to get more things done. Okay, have a great day.